Montrealers are living increasingly longer and in better health than in the past. Improved living conditions and ongoing technological developments are the main drivers of this progress. Yet all are not equal in sickness and in death. Health disparities, as it is now widely recognized, are largely explained by the conditions in which we are born and grow up, such as family income or level of education. To better understand this phenomenon, let us divide the population into 5 groups of equal size. Sorted by socioeconomic level, each made up of about 375,000 Montrealers. Let's compare the 2 groups at either end of the scale. The first group, the underprivileged, only accumulates 6% of the total income of the population. At the other end, the affluent group shares 39% of the total income of Montrealers. Six times more than the underprivileged. What defines these 2 groups? At the lower end of the spectrum, we encounter all welfare recipients, most minimum wage earners, more women than men, fewer seniors, and more children and visible minorities. The 2 groups differ on all counts. Now let's imagine that each year in Montreal, about 5,000 babies are born into each group. How will their lives and health evolve if current conditions prevail? 70 of the 5,000 underprivileged children will die before reaching the age of 1, as opposed to 19 affluent babies. Already at age 1, the number of deaths is unequal and significantly greater among the underprivileged than the affluent. We will also observe that the underprivileged will have longer hospital stays, will be 3 times as likely to be in single-parent situations, and will account for 8 times more teen births. 8 times. Newborns in the 2 groups will experience vastly different living conditions in terms of quality of housing, parental level of education, or family income. Let us now fast forward to age 6, when these children start school. Between the ages of 1 and 5 years, there will be very few deaths in either group. However, there will be 50% more hospital stays among the underprivileged. Upon starting school, 1/3 of underprivileged children show developmental delays. For affluent children, this figure is 1/5. Children who start school, thus deprived, are more likely to have academic difficulties in elementary school and hence are less likely to graduate from high school. What about at 18? Again, there will be very few deaths between the ages of 6 and 17. Hospital stays will continue to be more frequent among underprivileged children, who will also perceive themselves to be in worse health. Twice as many underprivileged Montrealers will not obtain a high school diploma than their affluent counterparts. Without a high school diploma, job prospects will be slimmer, salaries usually lower, and working conditions harsher. All factors which have negative impacts on health. Let us move up to age 40. Between the ages of 18 and 39, twice as many underprivileged citizens will die than those in the affluent group. The underprivileged will experience 35% more hospital stays than the other group, and they will perceive their physical and mental health as poorer. 1 in 6 underprivileged individuals will undergo periods when they lack food or the means to buy it, a virtually unknown condition for the affluent. Finally, let's look at what will happen when both groups turn 75. Between the ages of 40 and 74, the physical and mental health of Montrealers will deteriorate more rapidly. As a result, there will be more deaths and hospitalizations, and hospital stays will lengthen. Year after year, the gap between affluent and underprivileged will broaden and grow considerably. If current conditions should persist, almost 2,000 of the 5,000 people in the underprivileged group will have died by the age of 75. That's about 700 more than in the affluent group. So, what is the resulting picture at 75? More deaths, more hospitalizations, more disability, poorer overall health, and worse mental health. Thus, the socioeconomic conditions in which Montrealers are born and grow up largely explain why not everyone is equal in sickness and health. We have established that these conditions accumulate over time, resulting in ever-increasing health disparities over the course of a lifetime. Fortunately, our society can act upon these disparities from the moment a person is born and throughout his or her lifetime. If we disregard these inequalities, we collectively deprive ourselves of invaluable human, cultural, scientific, and economic potential. Imagine what these people could have accomplished during those years had they been healthy.